Okay, first of all, it'd be good to define anxiety versus fear. Anxiety being the apprehension about a future event. It's often called anticipatory anxiety because you are anticipating something happening in the future, typically something negative. Fear is actually the same basic physiological response, but to an immediate threat. Um, Again, both involve physiological arousal of the sympathetic nervous system, which is automatic. Both can be adaptive. Uh, Both help us escape or avoid danger and clearly has a survival function. A moderate amount of anxiety can improve performance on many tasks. If you're not motivated, nothing happens. If you're too motivated, it interferes with performance. You diagnose an anxiety disorder when fear is completely unrealistic or excessive given to the objective threat. Or, most importantly, if it leads to significant distress or impairment. So if you, for example, have a panic attack and walk out of the office and never come back to your job, or if you have multiple panic attacks and can't even hold a job, that's a sign of pretty severe impairment. So there are 5 basic subcategories. A specific phobia, which is most people are familiar with and just refer to it as a phobia. Fear of heights, fear of water, fear of closed spaces. Social anxiety disorder is when the anxiety is linked to a social situation. Panic disorder is when you have extreme, unpredicted panic, and really it's very much, people report it's very much like having a heart attack. Agoraphobia is typically presents itself in the context of panic attacks, and it's a fear of being in a public place and having an embarrassing panic attack and an embarrassing reaction to it. A generalized anxiety disorder is a moderate to great amount of anxiety which seems to be free-floating. It doesn't have a specific trigger, and it makes the person generally uncomfortable and tense. So those are the 5 categories. Anxiety disorders are the most common of all psychological disorders taken as a group. Almost 30%, 28% of the population will experience an anxiety disorder at some point in their lives. Most common is a specific phobia. Okay, specific phobia is fear of an object or situation that is, quote, out of proportion to any real danger. The specific DSM-5 criteria include marked fear or anxiety about a specific object or situation. The object or situation almost always provokes an immediate fear or anxiety reaction. It's actively avoided or endured with intense fear or anxiety. That point is important. Avoidance is a hallmark of anxiety disorders. So, for example, if you have a fear of elevators, but you are going to the top of the Empire State Building and climb in an elevator and take it to the top, you probably don't have a specific phobia. On the other hand, if you have panic attacks on the way up, or it's just endured with an immense amount of anxiety, then it would probably qualify. These things, again, are on a continuum. Fear or anxiety out of proportion to an actual danger posed by the situation is another criteria, and that's judged by your socio-cultural context. So the context is important, and that's culture specific. It's also a problem that can't necessarily be transient. It has to have occurred for at least 6 months, and it has to cause significant distress or impairment. This latter criteria is the one that all disorders list, and this is somewhat subjective, but it is probably the most important criteria. Basically, it's a problem if it causes a problem. The subtypes of specific phobias include situational, tunnels, bridges, elevators, public transportation, natural environmental phobias, fear of heights, storm water. Animal phobias are very common. Insects, animals, roaches, snakes, spiders, most common. Blood injury injection. People that pass out at the thought of having an injection or of seeing their own blood. Social anxiety disorder is a fear of unfamiliar people or social scrutiny. The specific DSM-5 criteria include marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others, including social interactions, meeting somebody, having a conversation, or being observed, eating in front of others, or performing in front of others. This is very common. Giving a speech. It turns out that although most people don't have a speech phobia, the anxiety is often there, and speech tends to be one of the very last courses that people want to take of the general studies requirements. What the individual fears is negative evaluation. They fear being humiliated, embarrassed, their behavior being embarrassing. They also fear being rejected by others. Other criteria include that it occurs in social situations, and that those social situations almost always produce anxiety. Actually, sometimes it's specific to a particular social situation, or it can be to all social situations, in which case you refer to it as generalized social anxiety disorder. The situations, again, like specific phobia, are avoided or endured with intense fear or anxiety. The fear or anxiety is out of proportion to an actual threat or the context. It has to be at least 6 months, and it has to cause a problem. One that I recall from my experience working in an anxiety disorders clinic was a salesman who couldn't really entertain people because he was afraid of, his hand quivering, trembling when he went to sign a check and that sort of thing. Panic disorder includes anxiety about recurrent panic attacks. A panic attack, in my opinion, is a really good prototype of anxiety disorders in general, because the fear here is so severe, it marks the basic dynamics of what you get with anxiety disorders, which is if you're in the throes of one, if you're in the throes of anxiety, and especially a panic attack, you want to escape by any means, and if it's already occurred, you want to avoid by any means. Basically, panic attacks like sort of a mini heart attack, except there's nothing happening with your heart except it's beating faster, and but there's nothing underlying wrong with it. But you feel like there is. So there's a abrupt surge of fear that reaches a peak typically within minutes, and it includes at least 4 of 13 symptoms. The symptoms include heart racing, it's often referred to as tachycardia, sweating, trembling or shaking, shortness of breath, smothering sensation, feelings of choking, chest pain, nausea or abdominal distress, faintness, lightheadedness, fear of fainting, chills or heat sensations, numbness or tingling sensations, feelings of unreality, feelings of detachment, and the last 2 are cognitive symptoms, a fear of losing control or going crazy, and a fear of dying. So you have to have at least 4 of these to get to meet the criteria of an anxiety or panic attack. In my experience, some people think they have had a panic attack, but unless you report one of the last 2, probably not. When people have this sort of reaction out of the blue, they need to account for it to themselves. And the most common closure is the thought of fear of losing control or going crazy, or a fear of dying, fear of something catastrophic is happening. The DSM-4 criteria for a panic disorder, note that panic attack is not a category, but if you have meet these criteria, then you get a diagnosis of panic disorder. So you have to have recurrent, unexpected panic attacks. The attacks are uncued, that is, they come out of the blue. Some panic attacks people have out of their sleep. At least one of the attacks has been followed by a month or more of at least one of the following: worrying about additional attacks, worrying about losing control, having a heart attack, going crazy, and a maladaptive behavior change related to attacks. They change behavior to avoid panic attacks, and often because there's a classical conditioning of internal cues, people avoid exercise or unfamiliar situations, but which make them anxious, and that seems to be a trigger for additional attacks. A good example of the maladaptive behavior is the one that I mentioned before. Is a patient I knew that had a panic attack during a work situation, got up, walked out, never came back. Agoraphobia is worrying about having a panic attack in a situation in which it would be very difficult to leave without embarrassing yourself or being very noticeable. In agoraphobia, what typically happens in agoraphobia is that the person they avoid being out in public, and they seek a more secure, private situation that is their home. So it's a retreat to their home and a fear of going out in public, but in particular, often a fear of specific places. And the two of the following listed here: open spaces, public transportation, enclosed spaces, standing alone in a line, or being outside of home alone, generally speaking. Sometimes people can tolerate going out in public if they have somebody that provides some security and support. Also, people will go out in different, the anxiety and the behavior can vary from day to day, depending on whether you're having a good day or a bad day. Individual fears, he or she fears or avoids these situations for fear of not being able to get out of the situations, for fear of developing, also as an avoidance procedure, to fear of developing symptoms, fear of something really embarrassing happening during the panic attack, like falling or incontinence. Agoraphobic situations almost always produce fear or anxiety. The agoraphobic situations are avoided or require the presence of a companion or are endured with intense fear or anxiety. And the fear and anxiety is out of proportion to the actual situation. Again, that's a judgment. Have to be prevalent for at least 6 months and cause a problem. Generalized anxiety disorder is often called the worry disorder. You have uncontrollable worry for at least 6 months. The key word here is uncontrollable. The people, everybody will say, stop worrying, but the person really cannot. They are not in control of this process. So generally what you get is excessive anxiety or worry, and it has to occur more days than not. It should be about a number of different events or activities, and it should persevere for at least 6 months. They say here it finds it difficult to control worry, but in my experience, it's next to impossible. You have to have at least 3 of the following. These are self-reported by the patient: restless or feeling keyed up or on edge, being easily fatigued, problems concentrating, irritability, muscle tension, sleep disturbance, which is all of what you would get if you are highly anxious. And then, again, it has to interfere or impair functioning in some way. So if you're tired because you can't sleep, because of worry and anxiety, and then you don't function well at work, that would be an example. Okay, here's a clicker question. Robert is very anxious about being in crowded places, such as shopping malls and restaurants. He worries he might not be able to leave quickly enough if he were to become overwhelmed with anxiety. He has vague fears that something terrible might happen, and he won't be able to escape. Over the years, Robert's fears have worsened to the point that he now hardly ever leaves his apartment. Robert probably has specific phobia, generalized anxiety disorder, cyclothymia, agoraphobia. The answer is agoraphobia, D. Another question. John misses a lot of class. When he does attend class, he rarely, if ever, participates in class discussions. John's professor recently met with him to discuss his frequent absences and low level of participation. John disclosed he's very nervous about coming to class. afraid of doing or saying something that might make him look bad in front of the other students. John probably has A, specific phobia, B, generalized anxiety disorder, C, social anxiety disorder, D, agoraphobia. The answer is C, social anxiety disorder. One more here. Leslie has episodes of intense fear accompanied by shortness of breath, chest pain, nausea, and dizziness. The episodes come out of the blue. She worries that she might be having a heart attack or going crazy. Her doctor has assured her that her heart is functioning normally. Leslie probably has specific phobia, A, B, generalized anxiety disorder, C, social anxiety disorder, D, panic disorder. Classic symptoms of D, panic disorder. Yes, another question. Carrie's friends describe her as a chronic worrier. She worries about many things, including grades, financial situation, health of her parents, experiences frequent fatigue and muscle tension. Carrie probably experiences A, specific phobia, B, generalized anxiety disorder, C, social anxiety disorder, D, agoraphobia. The answer is B, generalized anxiety disorder. Kevin's fiancée, Jennifer, wants to go to Hawaii for their honeymoon. Kevin doesn't want to disappoint her, but he is terrified of the idea of getting on a plane. Hard to go to Hawaii without getting on a plane. I guess you could take a vote. But anyway, Kevin has suggested that they go to Florida instead because he can drive. They can drive to Florida. Kevin probably experiences A, specific phobia, B, generalized anxiety disorder, C, social